Hi, I'm Jaime Ackerman. I'm a PA in Atlanta and have been working in GI for 20 years. I see many adult patients with IBS-C in my practice, approximately 5 a day. My patients often tell me that the symptoms of IBS-C, constipation and pain and bloating, make them miserable, and that they have to plan their life around their IBS-C. I want to do everything I can to help them find relief. The introduction of IBSRELA for the treatment of adults with IBS-C has been exciting for me. Having a medication with a different mechanism of action, and the first in its class, has given me more options to offer my patients, and importantly, different classes of medications for my patients. I let patients know that I will do everything I can to make them better. I want my patients to feel confident that I can help them, which is why it's important to let patients know there are different medications available and that we will keep trying different things until we find what's right for them. But I don't want them to think we're just throwing medications at them. I want them to know that we actually have a strategy, a plan. So explaining that there are different classes of medication and that if a medication in one class doesn't work, we'll go to another class, helps give patients confidence and hope. The first step in treating IBS-C is asking the right questions. You don't know the answer if you don't ask the question, and the way we ask questions is important. If we just ask a patient if their symptoms have improved, we don't get at how much their symptoms have improved. The question doesn't differentiate between a little improvement or a lot of improvement. So instead of asking, has your bloating improved, I ask, are you still having any bloating? If the answer is yes, I dig in to find out more. How often are they having bloating? How much of an impact is it having on their quality of life? So instead of asking if their symptoms have improved, I ask if they are still having symptoms. That is my starting point and helps me make sure I don't miss patients who will be a little better but still suffering from symptoms. And it's important to know this because with more treatment options available, if a patient is still having symptoms, I want us to consider trying a medication that works differently, that is part of a different class, because my goal is to help my patients get as much symptom relief as possible.
Indication: IBSRELA, tenapanor, is indicated for the treatment of irritable bowel syndrome with constipation, IBS-C, in adults. Important safety information. Warning: risk of serious dehydration in pediatric patients. IBSRELA is contraindicated in patients less than 6 years of age. In nonclinical studies in young juvenile rats, administration of tenapanor caused deaths, presumed to be due to dehydration. Avoid use of IBSRELA in patients 6 years to less than 12 years of age. The safety and effectiveness of IBSRELA have not been established in patients less than 18 years of age. Contraindications: IBSRELA is contraindicated in patients less than 6 years of age due to the risk of serious dehydration. IBSRELA is contraindicated in patients with known or suspected mechanical gastrointestinal obstruction. Warnings and precautions. Risk of serious dehydration in pediatric patients. IBSRELA is contraindicated in patients below 6 years of age. The safety and effectiveness of IBSRELA in patients less than 18 years of age have not been established. In young juvenile rats, less than 1 week old, approximate human age equivalent of less than 2 years of age, decreased body weight and deaths occurred, presumed to be due to dehydration following oral administration of tenapanor. There are no data available in older juvenile rats, human age equivalent 2 years to less than 12 years. Avoid the use of IBSRELA in patients 6 years to less than 12 years of age. Although there are no data in older juvenile rats, given the deaths in younger rats and the lack of clinical safety and efficacy data in pediatric patients, avoid the use of IBSRELA in patients 6 years to less than 12 years of age. Diarrhea. Diarrhea was the most common adverse reaction in 2 randomized double-blind placebo-controlled trials of IBS-C. Severe diarrhea was reported in 2.5% of IBSRELA-treated patients. If severe diarrhea occurs, suspend dosing and rehydrate patient. Most common adverse reactions. The most common adverse reactions in IBSRELA-treated patients, incidence greater than or equal to 2% and greater than placebo, were diarrhea, 16% versus 4% placebo, abdominal distension, 3% versus less than 1%, flatulence, 3% versus 1%, and dizziness. 2% versus less than 1%. Please see full prescribing information, including boxed warning, available at IBSRELAHCP.com.